For everybody. When we meet the last year in ICM, do you remember? Yes. So half of students participated in examination this afternoon. So some of them missed the class today. This class we will study the medical psychology. So the last class you may learn some basic knowledge of psychology. You ready? So you have some simple conception about the psychology, perception, personality, emotion, right? So this afternoon we will focus on the medical psychology. The new course is very important and basically course for the physician's trainings. These 2 hours will talk about the overview about the medical psychology. We need to understand what is the medical psychology, what the medical psychology research, and why is important for the physician and for the doctor. The definition of the medical psychology. This is the interdiscipline between medicine and psychology. So it not only it involves the biology, it integrates the psychological and the biology and the medicine. So there is an interdiscipline course. This course concerns with the relationship between psychological variables and health factors. Medical psychology will emphasize the psychological variables, how to interaction with some biological factors. What is the psychological variables? Do you know? Could you think about what kind of psychological factors is very important in the clinical practice or as a doctor? If you are a doctor, what do you think about the patient, which could be reflect the psychological problem? Stress. Really? Stress. Okay. Have any other psychological variables? Depression, emotional problem. Mania. Okay. Schizophrenia. Phobia. So everyone could have a biological problem. Could have some mental problem, have some emotional problem, because each one lives their specific environment, specific cultural background. Just like you study in China, you live in maybe cross culture. You need to keep your original cultures. Also, you need to learn and custom the new cultural environment. So each patient, not only the biological being, there is integrated, involve the biology, psychology, and culture and society. So psychological variables could be some personality, stress, emotional problem, relationship with others, maybe have this person's idea about the health, disease, and his social environment, really. So this is the definition of medical psychology. You need to know this is the interdisciplinary, integrated psychology factor and biology. So some doctors say medicine is art, not only the skill, not only the technician. It's art. Means art. The doctor see the patient. He's integrated this different aspect of the person. This is a simple pictures. This picture shows in the daily general hospitals, we have a lot of patients suffer from the disease and hospitalization, his family always get sad, get suffering, stress. So if one of the family members get disease and in hospitalization, the all family members must involved, okay? Maybe they have emotional response to the patient. Maybe the family can feel very sad, depression. Maybe the family become financial problem. It must cost a lot of money of the families. Maybe the family's relationship changes. They cannot communication as original race. Some patients, the family member cannot pay all to the patient because he's sick, he's in the hospital. He cannot support himself. He needs the support from the family members. So if the patient is on cancer, you know, if the patient gets cancers, the doctor will communication with the family members. But many family members ask the doctor, never tell the patient. Maybe he will be crushed. He cannot support his belief, his health belief. He will lose all hope. Really? So this is a family is a system, big system. Each one of the system get the illness. The other members will get a response. Every aspect of the family will be changed. Financials, emotions, communication skills, and the relationships. So a key problem to research about medical psychology. Medical psychology will research the psychological and the behavioral problem in the medical field. This course, this field, will research the psychological and behavioral problem in the medical field. And will use the application of the psychology in the medical field. Doctors, nurses, medical care providers, how to use the psychological knowledge in the medical field, the medical practice, to help the patient get a good health care service. So that is why physicians need some basic knowledge about the psychology. They help the physicians under the patient's demand, the patient's emotion, the patient, what is the feeling of the patient when he gets a disease. How can find the good way to help the patient, except the drugs or operation? Have any others to help your patient? Maybe you need to intervene the whole family and help the patient. Maybe you need to make the patient feel safe, trust, hope. This is very important. So the questions we need to